guys, welcome back to my channel. I'm Joanne and today we'll be looking into medical school interview, edition, plus a little bit of UK medical school in general. So a brief education background of me. In secondary school I did IGCSE, which is equivalent to SPM, and after that I continued with A-levels at College Yayasan UUM, KY before applying to MBBS course of University of Malaya in Malaysia via both UPU and Satu channel because I was desperate at that time, which eventually and fortunately I ended up getting both offers from both channels. And also because I did not take the SPM subjects as per required, I took it afterwards during my A-levels so that I could use the results to apply. In short, my pathway was IGs, A-levels, and MBBS. So this video will be divided into part A and part B, and altogether it consists of 5 components in total. The first 3 components will be discussed in part A, which is this video, and the next 2 components in the second part B. First component we'll look at is the type of question asked. Second is the checklist of what you should do, and in my opinion the bare minimum that is required to do well in an interview. And third component is the helpful resources. And in section B, I'll do a mock interview based on the actual question that me and my friend actually got from the actual interview. The last component is speaking tips. And the reason why I filmed this is because I actually started my interview preparation by watching YouTube videos besides attending seminars, which I find it very helpful, and I hope to give you, based on my experience, something that will be helpful for you to do well in your interview. Disclaimer is that this is from a perspective of a year 1 medical student. I have not been in a place of an interviewer who hold the power to decide the admission of a student into the university, but I try to make it as holistic as possible and ask around for interview tips from my batchmates who are taking other pre-U pathways and some current medical school students studying in other medical schools. And because I actually prepared for UK medical school interview at a very early stage before I applied to although I didn't end up applying to UK, but I've collected information, I should say advices, from 2 of my friends who are actually studying in UK and Cardiff and Dundee respectively, which I will drop their advices at the end of the video. So without further ado, let's dive right in. So first we'll look into the types of questions asked in a medical school interview. Actually, the structure of medical school interview varies from medical school to medical school, and is, as far as I know, the only school in Malaysia that actually have a really structured multiple mini interview, MMI, that is similar to that in UK universities, based on my own experience and my friends studying in other public universities like UKM. MMI, as opposed to the simple traditional interview, has 2 types. One is the formal interview sessions where you are given a question, but then you rotate from one station to another and you answer the question. And the stations can be formal or practical. Practical is where you have to do a task or writing or like work in groups to discuss something. And University of Malaya, they mostly do formal interview session. There is barely any practical interview sessions. And others will maybe do simple traditional interview that doesn't involve going from one station to another. In by the time I went interview stations are actually categorized into, if I'm not wrong, 4 stations, which they explicitly told us during the day of interview, but I couldn't remember, and I've yet to find somebody who can actually remember the categories of the questions. But based on the question that I've got and my friend's question, I have categorized it into 4 different categories, which I think it will be similar to the one which I could not remember. So first is the interest in medicine and personal motivation. Personal motivation involves like, do you know what it is like to be a medical student or doctor? How many years it will take, and do you know how stressful it will be? And why are you suited for medicine? And for interest in medicine, questions asked will be like the use of information technology, IT, in medicine, or who's the part of the team. As a doctor, who do you regard as the part of the team? You can say other doctors, nurses, managers, bed managers, ward managers, or secretaries. The second category is interpersonal skills and personal insights. This is where you have to elaborate on your character and how these traits are useful in the practice of medicine. Like, what hobbies do you have for you to become a better doctor? Or how do you cope with stress? Or tell me an example of a situation where you have demonstrated you have leadership skills. This is to see if you have identified your own skills and that could be useful in your journey of pursuing medicine. And the third one is current or controversial issues. And this, I subdivided it into two subdivisions, which are in this country, Malaysia, and generally. And in Malaysia, they can ask you, Generation Endgame, what do you think about it? About vaccination and legalizing medical marijuana. In general, it is similar to BMAT essay questions. And question asked can be on euthanasia, abortion, like organ donation, social media, drug. Alright. And the last category, the fourth category, is situation judgment and critical thinking. This is where you are given a situation. For example, you cannot deal with the death of a terminal patient. What would you do in that situation? Or you have seen a colleague breaching a patient's confidentiality. What would you do in that case? And there is also a specific question which was asked in my year, which is prioritization, which I would say is not very formal MMI interview, more to practical prioritization, where you have to, based on a list of items, then you select, which one will you bring on a jungle trekking and why? So you have to employ your critical thinking. And other than these four general topics, there are a few division which I think can be applicable to all of the four categories. These are the medical ethics, the 4 pillars of medicine, and health law. And health law specifically, I am referring to, for University Malaya, the abortion, specifically section, you don't have to memorize like the Medical Act 1970 Act 50. Okay, you do not have to remember the name of the act, but you have to know that abortion is illegal in Malaysia unless the act of pregnancy or the act of having a baby cause injury to the mental health or physical health of the pregnant woman, which is greater than if the pregnancy was terminated. So you can only stop the pregnancy if the mother is suffering from great mental health issue or physical health issue. Otherwise, it is illegal. It's an important fact to know, but you don't have to. I don't think you have to know other health laws. Don't burden yourself with those. You just have to know abortion and euthanasia are illegal. So you cannot. Euthanasia is strictly illegal in Malaysia. Other than medical ethics and health law, you have to always employ your reflection skills. They could ask you, what have you learned from the COVID-19 pandemic under interest in medicine category? Actually, the categories sometimes intertwine. Like the interest in medicine, you can argue that is also in interpersonal skill and personal. But this is just to give you a rough idea of how the things can be categorized. So if they ask you, what have you learned from the COVID-19 pandemic, you have to employ your reflection skills. Even if in questions like, how do you cope with stress, you have to reflect on your own, like how do you actually cope with stress. The third one is professionalism, which, for example, just now the case, you see your colleague breach a patient's confidentiality by, like, for example, disclosing the patient's information. You have to include the professionalism in it also. Okay, actually this you can dismiss it. Okay, just know that you have to be professional always. It's just like the medical ethics. Okay, and then afterwards we'll look into the United Kingdom Medical School interview. For United Kingdom Medical School, it is different from Malaysia in the sense of they need a personal statement. But actually, Newcastle, if I'm not wrong, in Malaysia, they need personal statement also. So you actually need personal statements, and in interview, there could be questions on what you have written on your personal statement. Some medical school, they base their interview solely on the personal statement you wrote. And why the university? Why Edinburgh? Why Cardiff? Or why IMU? Why this university? Can say it in the sense of like the course structure, teaching style, maybe it has associated hospital location, your social life is very near your house. You can actually say it at the end after you have talked about the course structure and teaching style. Or like there are other universities with the same teaching method. Why this one in particular? You can say, oh, it's built in a town where art and medicine collide. It has a lot of historical feature that personally you like it a lot. Yeah. The other question type that was not included in a UM interview 2022, but it could be in other interviews, is role play. Like you just ran over your neighbor's cat, you killed it while you're reversing your car. Tell her about it, and then there will be an actor A standing in front of you, and to confront her about, not confront, you have to talk nicely and be empathetic and tell her, do you have time to talk? So sorry, There's role play where you involve acting and you really have to employ empathy. Perhaps you're a pilot, you're driving a plane, and suddenly there's a patient who has a cardiac arrest, but you're already running late. Do you take the risk to do emergency landing to the nearest hospital or continue flying the path as directed? Like, how will you communicate it to the people? Actually, this is somewhat of a situation judgment also. And then UK universities, they could be more of a practical MMI station where you were, for example, given a diagram showing a layout of a building, and you have to give the interviewer directions to get from entrance A to room B. Yeah. Or you're given a graph showing the plasma insulin levels of a patient over one day. With the times meals were eaten, you're asked to describe and interpret the graph. For UK medical school, the important thing to know are NHS and GMC. Good to know things are, if you have read all about NHS and GMC, you can read about British Medical Association, BMA, Medical Defence Union, MDU, or Care Quality Commission, CQC. And I'll also briefly talk about other universities in Malaysia. In UKM, you have to speak in Malay for a certain number of questions depending on your interviewer. For Utah applicants, you can go online and search Utah interview questions. And also search for the essay questions also, because you have to write an essay on the spot. And you're good to go. For IMU applicants, although it is stated that they have MMI interview session, but from experience, the interview stations, MMI, was not very structured MMI interview stations. And if you follow the bare minimum checklist that I will be listing below, it is more than enough. So now we have reached component 2 of the video, which is the bare minimum you're highly encouraged to do or know before you go to an interview. What you should know, okay? You should know, okay? Know that. It will be helpful eventually. So make sure you get this list checked before you go to any interview. In the preparation phase, first is know the 4 pillars of medicine, listed as autonomy, non-maleficent, beneficent, and justice. You just have to apply it whenever suitable, especially in questions involving current or controversial issues or situation judgment and critical thinking. Can say that for the breaching of confidentiality. You're violating the patient's what? You're violating the patient's autonomy. And justice is very applicable in the case of organ donation, where justice means you can only discriminate on the basis of different clinical needs. Like the benefits risk and cost should be spread fairly. For example, if I give the organ to this person, then you benefit way more from the organ than person B, because perhaps it is more compatible with him, or he just clinically needed it more. But you cannot discriminate based on the social status, how much money he or she has. Okay, there's justice. We must also, not under the 4 pillars of medicine, but one thing that's good to know is the competence of patient. So in Malaysia, adults and children over age of 18 are considered competent, which means they are capable of making rational decisions by themselves. You have to make sure that the patient has the capacity to consent, or the mental capability to consent before making a decision. And before you do anything to a patient, you must get consent. You take a picture of his wound, you get consent. Everything, get consent. If no consent, that's a medical misconduct. That's all that you should know about consents, and the 4 pillars of medicine, you just have to apply it rationally. And second is to know yourself. You must know why you want to do medicine before you even go to an interview and decide to embark on this 5 years of journey. It's a fundamental question you have to answer. You might not get asked, but at least you should know it yourself. You must ensure that your own reason of doing medicine are clear in your mind. I think this builds the foundation for you to do anything else. And when I say by knowing yourself, you not only know why you want to do medicine, you should also know what are your strengths and weaknesses, which the interviewer can dive further into. Give a situation where you have demonstrated why you can work well in a team, or is a good leader, or have empathy. So it is important for you to identify your skills and prepare a specific example. It's notoriously difficult when you're already in that situation, and what if they ask you describe an example where you have become a good team leader? What if you panic and you couldn't think of an example where you have actually became a leader or play an important role in the team? Then you're doomed. Without preparation, you will come up with examples that cannot show your fullest potential. You are there to sell yourself. Answers such as, I always work in team. I work in team at school, in my work experience, and also in my volunteering job. That is such a bad answer. The specific example that you can generate is perhaps, I was the captain of my school volleyball team, and in that, you spend a lot of time with your teammates discussing tactics, and in a specific example where your team has conflict and how you resolve it, and demonstrated your skills, listening skills, prove that you can communicate constructive and listens attentively, is reliable and can take responsibility on your own. So give a specific example where you can throw those, you can put those attributes in. Attributes of you understand your role in your team, and you can work well to achieve the common goal. You are willing to help. Okay, so that's what I mean in knowing yourself. Know why you want to do medicine, and know your strength and weakness with specific example of those things. Third is to read about medical issues, current issues and controversial topics. I know I was so overwhelmed when I was preparing for this session. There were so many topics. There was just so many topics. I was like, if I want to finish reading it all, I just won't do it, because that was too much of a burden, too much of an activation energy to overcome to start this. So I have listed down some of the medical issues that are very frequently asked. First is, there are only four basics one up. So after you have prepared this 4, maybe you can go read others. And please don't blame me if this does not come up, but this come up very often. That's why I listed it. First is euthanasia, abortion, organ donation, and the use of information technology in medicine. And what if they ask questions other than the medical issues that I have mentioned? Be able to think on your feet. That is the fourth bare minimum thing that you should have. Be able to think on your feet. Have a habit, right? If you are not sure, have a habit to speak up your train of thought. It is very important and highly valued, as far as I know, in UK and US interviews, and especially in UM's Satu interview direct. You don't actually have to know the perfect answer or the correct answer. When I went to UM interview, I did not know about abortion was illegal in Malaysia, with just the two exceptions: great injury to mental or physical health of the mother, which is greater than having to have a baby. And I gave the wrong answer with the wrong fact. You must be able to reason your statement well. It is so much better to say, oh, I actually am not sure about this, but I can try to answer it from the perspective of this and this, rather than you just sitting there blanking out and not saying a word because you don't think you have the correct answer. So be able to think on your feet and always speak out your train of thought. Last but not least is the most important component, as I said, practice. Okay. Not only you have to practice your tone and your speaking speed and how you present yourself in a confident yet humble disposition, you have to practice your timing. Timing. I can't stress it enough. In MMI stations, timing is crucial. You only have 1.5 to 2 minutes to answer the question. And once the time's up, you have to stand up and switch place. And if you're in the online meeting, the Zoom meeting will be closed. And even if you're halfway speaking, right, perhaps you have 3 points and you only on your first point, you haven't even concluded yet, and your time is up, then you're gone. You're just pop into the next station, and you will not be able to tell the interviewer however brilliant points that you have, because the time is up. So practice to speak within the time constraint. The time that I recommend is 2 minutes. At least in 2 minutes you have to finish. In the case of like preparing a specific example on your strength and weakness, once you have done that, once you have drafted your ideas out, record yourself speaking it at least once and take note of the timing. My experience yet again, in my UPU interview, it was online because I couldn't make it physically. So I joined the online interview. And God, I was cut off very badly, so don't do that. From the blood and tears of my own experience. So then afterwards for my Satu interview, I timed myself much better than I did in my UPU interview. Okay, have this clock, right? Like you can switch it. Time it. Time 1 minute. Time 2 minutes. Time yourself. Use like clock or your phone. Time yourself. Look at it counting down as you speak. And once you exit the time, okay, then just reflect on it and make it better in order to fit into the timing. And that's all about the bare minimum which I think you should do. Oh, and also for University of Malaya specifically, when in the preparation phase, you have to equally prepare the 4 types of questions that I stated just now. Like you cannot allocate all of your interview preparation time into preparing a specific example of yourself in knowing yourself, because the proportion of this different type of question in the interview will be the same. So there will be equal number of questions asked about interpersonal skill and personal interest and situation judgment. So make sure that you devote your time wisely and make sure you are prepared for all types of questions. Now we reach our last component for this video, which is the helpful resources that you can use. And I'll discuss the 4th and 5th component in my next video, which will be a mock interview with actual interview question and the speaking tips. As for helpful resources, there are a few you can refer to. First is YouTube video. The channels recommended are Ali Abdal and Karma Medic, which a lot of my friends and I personally use this. Try and look for their scenario-based question, and they'll give an explanation sometimes they'll give explanation to the question. They give example answers and questions, which is very helpful. And for UK applicants, you can go and read up about NHS hot topic. And as for applicants, you have to pick it wisely because some of the components are not included in Malaysia interview. There are also, other than YouTube videos, you can attend talks and seminars. If you really want some physical, palpable sources, you can go buy a book, which this book, Medical School Interview, is quite helpful. It's written by a Malaysian named Dr. George Lee, who was a Cambridge and Oxford medical school student, if I'm not wrong. But this book can somewhat be overwhelming because in actual situation, you don't have to be prepared with all of the questions listed in the book. It can be overwhelming sometimes if you do that, because not all will be asked, and if you really prepare one by one, it will take a lot of time, unless you have all the time in your world and you want to like really prepare. But I don't think it is feasible, so it's more unprioritized. And fourth is not exactly a resource, but all the resources won't be as helpful if you do not do this. Okay, so the fourth one is practice. Take action, because you don't know what boils in your head if you don't speak it out. Even if you have the most perfect idea drafted in your brain, but you never know what comes out of your mouth when you say it, especially under time pressure and pressure from interviewers. And especially if you haven't been in a situation where you are used to doing public speaking or impromptu speaking, this can be quite a hurdle to overcome. So do practice. Practice really makes perfect. And with this ends part A of medical school interview questions video. And if you watch until here, you have learned the type of question asked in a medical school interview, what you can do, a checklist of what you can do, and the helpful resources where you can seek further information from. So this video is basically a preparation to help you to prepare for your interview. We'll move to the speaking mock interview and the speaking tips later in the next video. So stay tuned for part B. Bye bye.